beats. I'm feeling very good, so that I'm entitled to my strawberry shortcake and with whipped cream. I don't know about the rest of you. But actually, let's turn to our next panel. And we're going to be hearing from Nancy Bill, who's the Injury Prevention Program Manager at the Indian Health Service, and Lawrence Robertson, who's the Director of the Indian Highway Safety Program in the Bureau of Indian Affairs. And I think, as the committee knows, we've been really interested in this topic for a variety of reasons. Clearly, there are a series of equity issues. There are issues that regard how do we best deal with different ethnicities and reach them. Some of the rural health issues, some of the community-based issues, because I know many of Native Americans are not in rural areas, but they're in fact in cities, often disconnected from their families. So we have a lot to learn, and so we're really grateful that both of you came. I don't know, are you going to be speaking first, Ms. Bill? Great. So thank you again for coming in, and thanks for being here all day. We appreciate it.
Thank you. Good afternoon. My name is Nancy Bill. I'm from the Navajo. Actually, my background, I'm Navajo from New Mexico. But I work here in Rockville, Maryland with the Indian Health Service. I'm the Injury Prevention Program Manager. And let's see. I just want to quickly give a quick overview on the status of American Indian and Alaska Natives and injuries. This chart here shows a trend of the past years from the 70s to 2008. And this is Indian Health Service data. Unintentional injuries, deaths, I should say, for all American Indian and Alaska Natives. But I want to show just the disparity that exists compared to the all U.S. And when you look at closer, you see that what's the leading cause of injury? We see motor vehicle as a leading cause. I brought a couple of books. I don't know where they're at right now. I didn't bring enough. Yes, for the committee here. This document is also online, and I will send a link to the program people here so you can send it out. The data here I'm presenting is from this book. It's compiled from all the areas that serve American Indian Alaska Natives that are federally recognized. So this report compiles tables and talks about trends on Indian injuries and American Indian Alaska Natives. And it's actually a snapshot, although the data is from 2004 to 2008, I believe the latest. It still is really gives you a snapshot of what's really going on even today. It's really gives a good picture of that, what's going on in Indian health. We know that the trend shows that unintentional injuries is slightly decreasing, but it's still high. And with the major component, again, is motor vehicle. And within the motor vehicle, the alcohol-related injuries is very high, as you can see, even surpassing the all-U.S. rate. If we look at age and sex, we see again the trend of we have that high range in the 20s to 30s of unintentional injuries, and we see that males are really at risk. And then we look at by area. The Indian Health Service breaks down to 12 regions, or 12 areas, and so this chart here shows the 12 areas. And if you look closely, you see that it shows, again, the unintentional injury problem or fatalities by region. Again, Billings area actually is the highest, closely followed by Navajo and then the Great Plains. And then we just look at motor vehicle, it's very similar. Again, it's the northern Billings area, the Navajo, and the Great Plains kind of leads that. I was asked questions, and I'm going to address the questions in the email that was sent to me. Questions were the challenges to driving impaired in American Alaska Native populations, and I'm speaking in generalities. Actually, American Indian issues are very complex. I was talking to my colleague here, Lawrence, and you know, we both are from Native American communities, and growing up around the community, and then coming to now, I could see the huge disparity in poverty, economic opportunities, educational opportunities, and all the issues. To me, it's a comprehensive approach that needs to be done with American Indian issues, in my mind. So, but some of the things address American Indians and Alaska Native in terms of impaired driving, and I'm going to speak in generalities here, but the collaboration between tribe and state, I hear all over from it with different tribes. There's not very much collaboration going, although some states, like you saw the Montana and the North Dakota and New Mexico and those southern states have high rates of alcohol-related fatalities in those states for tribes. We don't see those tribes in state plans. They may be talked about, but they don't see there's no action steps to help incorporate how to address it. There's a lot of issues with the state and tribe, but I'll have Lawrence talk more about that too, because he also has something to share. Sharing records, I hear that a lot. Tribes don't share the DUI records with states, and that is can be complicated. It's some it has to do with sovereignty issues. Some is just that records just don't get shared. So that's an issue. Addressing again traffic records, the same thing. And then competing priorities that we heard from our last speaker, with law enforcement, and tribes, there's a lot of competing priorities. If you heard in the news, many tribes face not only this issue, but they face bigger issues with environmental issues, with, issues with healthcare and and economic development. So there's a lot of competing issues with tribe and tribal leadership. So when I go to a tribal program or a meeting, they have a lot on their agenda, and the last thing they want to hear about is injuries. Although it's important, and I try to draw that attention that injuries is a very important issue with with all that. The other things I don't have listed on here is technology. Many tribes, when agencies work with us and they want to talk to tribes, they say, we'll do a webinar. Then you find out that, well, that's fine, but some tribes don't have internet connection. They're so remote that, they don't have even the hardware. So those are issues. And one I want to mention also is the historical things with tribes. Every tribe is different. There's 556 federally recognized tribes, and there's another list I've seen on the BIA site of tribes that are trying to gain recognition, that are state recognized. So all the tribes are different, from the East Coast tribes all the way to Alaska. And so we can't approach tribes like a blanket approach, because every tribe has to be is unique in their history and their land, their culture, their language. So that's also just a note. Social cultural factors. I was looking at a report recently with Navajo. They did a report on motor vehicle crashes. The one thing that came out that I saw that is still to this day is that the crashes involve multiple people. So what that means is that there's a multiple passengers in these vehicles, unrestrained children, intoxicated driver bringing his family, or intoxicated driver head-on collision. And there's large families in these vehicles. And that's really common when you get into the rural areas, especially in the Southwest. The vehicles, there's large families that present these problems. The other thing that I had listed on here is tribal infrastructure. I think a lot of the tribes, in my working with tribes with grants and funding, a lot of tribes don't really have the infrastructure, even to some of the management of large funding or even small funding. There's turnover in staffing and there's a lot of issues with the tribal infrastructures that can cause problems that I don't say it's cultural, but those are issues that are, to me, is kind of unique because and then I put down tolerance by community. The alcohol problem, as you saw the data, some tribes, there's a sense I put on there. Well, some tribes are just tolerate it. They just tolerate it. And it's not shocking. It's become a norm that there's a crash with an alcohol-impaired driver. It's become a norm. And the other thing I listed is hopelessness. And that leads to hopelessness because communities feel they've done all they can, or they got all the resources they think, and there's just a sense of hopelessness. I spoke to tribes and individuals who have shared this with me. And then the rural and remoteness also poses problems too, because as you heard from the sheriff earlier, he has all these issues that he brought up, which was also apparent with rural communities with tribes. The other one is binge drinking. I didn't put that on there, but there's things with binge drinking because people have to travel long distances to, if a native reservation is not, doesn't sell alcohol, that means people have to drive to the nearest town, which is a long distance, or go, and then that drive back poses a problem. So, and then also to me contributes to binge drinking because people will drink all they can, because there's not that much alcohol, or alcohol is not allowed on the Indian land. So binge drinking is a big issue. Underage drinking is also an issue that, let's see. Again, these I'm answering questions that were given to me. How road conditions and remote contribute to higher fatalities. Many of the tribes don't have, I would say, a trauma center. Indian Health Service don't have a trauma center that can really address some of the severe injuries. So many times people are transported out from the site. They're stabilized and transferred out to these trauma centers around the state. And this is an issue I think that needs to be looked at even carefully, but that's what the situation is. Transportation is also an issue for remoteness because some of the rural roads were made back in the 1950s for traffic that was running 55 miles an hour, and now we see people driving at 70, or maybe faster. So EMS level, I think I'm gonna have Lawrence talk about that because he was an EMT person at one point, but EMS is also an issue, the response time. I tell people there's no golden hour on the remote sites in Indian country. 911 systems, some tribes don't have access to good 911 system. The system, you're sent to the nearest urban center, and then they send the contact to police, and then so there's the issue of, like here in living in Maryland, I think the response time is probably 5 minutes or less. You can it's very fast. But so that's an issue. Ambulance availability, I hear that a lot. In the remote site, sometimes there's two ambulances and they're out and there's a crash. And then they have to wait till the ambulance get back to the health center. So that's an issue. Then rural addressing. This is where a lot of the rural sites in Indian country, they don't have addresses, street addresses or home addresses. And that's being worked on, but that's also, I think, poses a problem when you're trying to locate or call for help. Again, I'm going to speak in generalities, but this is over the years, our program, Indian Health Service, has worked closely either with the BIA, with NHTSA, with Federal Highways, and with us, actually also with the CDC offices to work together so how we can strategize how to approach injuries as a general problem. And alcohol impaired driving is part of that. So the things that seem to work is that collaboration needs to happen. We can't work in silos. We have to have partnerships, those key partnerships. And right now, at the national level, we need the key partnership with BIA, which we have worked together at NHTSA, CDC, Federal Highways. At the local level, tribal leadership, law enforcement, again, the same group in different wearing at the local level, working with the state and local authorities. And then tribes need to be included in these state plans. I want to stress that because I've seen state highway plans and they're great, but many times the tribes are either mentioned or they're not really addressed, and yet they have the highest fatalities from alcohol-related crashes. So that needs to be addressed. So what do we do in in-health service? We use a public health approach, as many of you probably are familiar with. And we do quite a bit of training with our staff and with tribes to get a handle how we're going to approach these problems from the public health standpoint. And we utilize the training. We identify the site through data, identify the issues and where we can best address through policy, environmental changes, or education. And then involve the key stakeholders like tribal leadership, community, law enforcement, and state local authorities. And we just wanted to reduce all the rates and improve our policies, bring more resources, and make it a tribal priority. And then I'll just quickly share some success stories that we have worked. Our program funds tribes to, again, develop their own injury prevention program with the focus, our priority is motor vehicle. And so I'm just quickly sharing that although all the programs don't really focus on motor vehicle, alcohol-related crashes, they focus on occupant restraint use, which is a big issue as well. So the Menominee tribe, they have, so they have decreased alcohol involved crashes. Again, utilizing that public health approach where they brought all the partners together and worked on it. The Pueblo Jemez, Pueblo San Felipe, Navajo Nation, and Oglala have increased occupant restraint use, as you can see. Kiowa tribe and Ho-Chunk and San Carlos Apache also had done things to increase seatbelt use. The San Carlos Apache tribe developed a policy for primary seatbelt use and tackling DUI, and they have made great strides in reducing that over the past years. And then the Kaw Nation, again, seatbelt use, and Northern American Indian Health Alliance, Ojibwe tribes. So.
Great. Well, thank you very much.